Did you know that colon cancer is the fourth most common cancer in the UK and one of the leading causes of cancer deaths? In this video, I'm going to be breaking down the 5 things that as a doctor make me think that you might have colorectal cancer, what to do if you're worried, and what might happen next. We first need to understand that there are 2 parts, the small bowel and the large bowel. Cancer can start in either, but the large bowel is more common. Depending on where in the colon a cancer is and its size basically determines the symptoms. The first symptom we're going to talk about is a change in bowel habits, such as going more frequently than you used to or becoming more constipated. The next symptom is noticing blood in your poo or bleeding from the back passage. And the third symptom is something called tenesmus. This is a feeling that your bowel didn't empty properly when you go to the toilet, or feeling like you need to poo even though you just went recently. The next symptom is losing weight without trying, presuming that you're not taking Ozempic. And the last few symptoms relate to anemia. So this can mean that you can feel really tired or weak, or sometimes feel dizzy, particularly when you're standing. It can happen because you're losing blood and you don't necessarily realize it. This is particularly worrying if this is persistent. Now, if you've had any of these symptoms for at least 3 weeks, you need to go to your GP. Depending on which one of these symptoms you'll have, either one of 2 things will happen. You'll either get referred very urgently for some further testing, and this normally involves a colonoscopy or a CT scan. If on the other hand your symptoms are a bit more vague, then they may ask you to do a poo test. And this is called the FIT test, which looks for microscopic blood in your poo. If this is normal, great, it rules out a colorectal cancer. But if it's high, it doesn't necessarily mean that you've got cancer, but again, it just means that you need the test that we spoke about earlier. Pretty much you're going to have a colonoscopy. Now, if you're in the UK, there's also a screening program. The NHS sends out one of these poo tests, the FIT test, every 2 years to everyone in the UK around the age of 60, but I think they're going to change the age of this soon. You should definitely do this test. It doesn't hurt, it's easy to do, and it helps detect cancers early, and that just means you're likely to receive treatment and have a better outcome in the end. Thanks for watching.